Welcome to Respira Medical. I'm Sandra Clay. I'm a respiratory therapist and the clinical coordinator for the CPAP clinic at Walter Reed Army Medical Center. I will be doing a brief overview of the CPAP machine that you will be receiving, reminding each of you that in your bags you will find your manuals. You have one on your CPAP unit and one on your humidifier. It's very imperative that you familiarize yourself with your CPAP unit so you, the patient, can feel comfortable in making the changes accordingly. The supplies included with your CPAP unit are your CPAP carrying bag. On the flap in the front, you will find your tubing and manuals. On the inside, there are two separate compartments, one for your CPAP unit and the other for your supply cords. This is your CPAP corrugated tubing. It is 6 feet 72 inches and it has interchangeable ends. Either end can go to the CPAP unit, the other end will go to your nasal device. This is your power supply, which connects and inserts into the back of the CPAP unit directly into the power inlet. You have two filters, the gray reusable filter and the white ultrafine disposable filter. You also have the additional adapter which connects directly to your CPAP unit when not using the humidifier, and the CPAP unit itself and its humidifier. And lastly, your power cord. Let's start with your CPAP unit. On the back of your CPAP unit, and this inlet here, goes your gray reusable filter. You need to wash this filter out once a week with warm soapy water, let it air dry, and simply put it in the outlet. You also have a white ultrafine disposable filter. This filter needs to be thrown away at least once a month, and I recommend it for those patients who have problems with allergies or sinus. The white ultrafine filter goes in first with the soft, cushy side facing out, and then simply put in the gray reusable filter. Next to the filters is your smart card, your compliance. Simply pull it out of its module and take this with you for any visits that you have at the clinic. Once your clinic visit is over, please remember to insert the card back into its module so it can continue to record. On the front of your CPAP unit, lifting up this flap here will take you to your display window. Beneath the display window, there are 3 buttons, and these are your comfort features. The first being the ramp. When you press the ramp button, it drops the pressure to 4 from your set prescribed pressure. Use this button as your relief as you are adjusting to wearing your CPAP unit, and it gives you time to fall asleep. Next to that, your start-stop button. You don't necessarily need to press the start button to start your unit. Once you have your mask on and you inhale, the machine will sense it and start within 3 to 5 seconds. Lastly is your C-Flex. C-Flex is the comfort feature for exhalation when you breathe out. A sensitivity of 1 to 3. Again, making it easier, with 3 being the most sensitive. To get into your menu options for the comfort features that you have the ability to change and to adjust, simply hit the positive sign. Scroll through your menu options with the arrows and make the necessary changes with the negative, positive, up or down. There are 2 other features that you have the ability to enable as well. One being the alert. Some patients take their masks off in the middle of the night unknowingly. If you enable the alert button, then the machine will beep to let you know that you've done that. The other being the automatic off. If you take your mask off and you want the machine to cut off, then enable that feature. And that pretty much wraps up everything on your CPAP unit. Lastly, your heated humidifier. It gives you the ability to heat up the moisture content in the air that is being delivered on a range of 1 to 5, with 5 being the warmest. I usually suggest to patients to start at about 3. Lifting up this flap will take you to your water chamber. You will be using distilled water. The instructions are right here on the side as to where to fill the chamber. Simply a little bit below the line is fine. Lie your chamber flat, push the lever to the left, and it will open up. Maintenance on your chamber: you should wash this at least once a week with warm soapy water. Change the water at least every other day. Remember to always empty the water in your chamber before inserting it back into your humidifier when traveling. Here at Respira, we offer a variety of CPAP masks, including nasal, full-face, and nasal pillow systems. A CPAP mask is used to deliver the air from your therapy device to you. A comfortable mask is a key factor in you being able to use your treatment daily. Please refer to the instructions that come with your mask on tips for fitting to maximize your comfort level.